Good morning, everyone. Thank you for taking time to join us. I am Jeremy Nordquist, president of the Nebraska Hospital Association, and we are here to talk today about a serious, solemn issue that's impacting our hospitals and healthcare workers across the country and even here in Nebraska. Today is the 6th annual Hospitals Against Violence Day, or HAV, H-A-V, Hospitals Against Violence, Have Hope Day. And it's a national day of awareness to work on ending violence in our hospitals and in our communities that our hospitals serve. Violence certainly is one of our nation's major public health crises and safety issues, both in our communities and inside our workplaces. And as we prepared for this annual day to highlight this issue, we had no idea we would face the tragedy of 2 hospital shootings just this week. First, 5 people were killed and multiple others injured on June 1st in a mass shooting inside a medical office building in Tulsa, Oklahoma, where the gunman targeted a physician who treated him. That same day, an event that got a little less press attention, a security guard in an emergency department in Dayton, Ohio, was shot by a jail inmate who was receiving care in that emergency department. And while these horrific events got the national attention they deserve, the violence against our healthcare workers is not uncommon or isolated to just a few incidents. More and more of our healthcare heroes are facing violence, both physical assault, verbal threats, and more are reporting it. During COVID, a national study showed 44% of nurses experienced physical violence during the pandemic, and 68% experienced verbal abuse in the workplace. And we know from national figures dating all the way back to 2018, healthcare workers are 5 times more likely to face violence in the workplace than the average worker. So today we're here uniting hospitals, healthcare systems, and nurses, doctors across the state to raise awareness about the violence that's happening inside our walls. And also, it's important to note that all of our hospitals are engaged in their communities and trying to do work to address violence in their communities that they serve as well. We're going to hear from 4 excellent guests today who have seen it, are working with nurses who are seeing these challenges every day, who are working to address security issues in their hospitals. So I'm honored to introduce our first speaker. Before I do, I just note again, if you haven't gotten recording privileges from Bryan, please send him a message on that. We will also send a recording of this out afterwards for your access. And then if you have questions throughout the conversation, we'll get to those after all of our presenters speak, but please put those in the chat box and then we'll facilitate Q&A after we hear from all of our guests. Our first speaker will be Dr. Lisa Vale, Vice President of Patient Care Services and System Chief Nursing Officer for Bryan Health in Lincoln. Thank you for joining us, Dr. Vale. Go right ahead. Oh, you're on mute.
Thank you, Jeremy. I want to begin by expressing my deepest condolences to our healthcare colleagues in Oklahoma who work on the campus of St. Francis Hospital in Tulsa. This was a horrifying tragedy that should not have happened at any hospital in America. Unfortunately, all of us are at risk for something like this to occur as we continue to see a significant rise in violence being perpetrated within our walls. Our ED staff are the most impacted as they care for patients coming in under the influence of drugs and alcohol, treating those with significant mental illness, or those seeking medical attention as a result of an external violent act. But violence happens throughout the hospital. It can be as simple as name calling, but it can get worse with use of excessive profanity, threatening comments or actions, spitting, kicking, biting, throwing things, inappropriate sexual comments or actions, and outright physical assault. At Bryan, we are committed to the safety and well-being of our employees, providers, volunteers, patients, and guests. Managing these complex issues and mitigating the risk of hospital-based violence is becoming ever more challenging, and it adds additional burdens upon healthcare facilities. We are constantly striving to improve our culture of safety by implementing data-driven best practices. On a regular basis, we also survey our staff to get feedback on what they identify as safety concerns, joining their voices with concerns identified through local and national trends to find the best practices to reduce risks. We strive to prevent workplace violence through strong policies, training programs, dedicated security professionals, a variety of strong technology solutions, and thorough case review and problem solving when incidents do occur. Additionally, working with local law enforcement, community partners, and legislators are also important steps to reducing current and future violence. What we are seeing is an increase in many types of workplace violence, mostly from the public, our patients and their family members, towards members of our healthcare team. Patients and visitors reflect the same polarity existing in society, with some refusing to be compliant with hospital policies for safety or infection prevention protocols, such as masking or vaccination requirements. According to the International Association of Healthcare Safety and Security, healthcare workers are 5 times more likely to be a victim of violence at work, even though we know these events are significantly underreported. At Bryan, in 2021, almost 60% of our employee-related OSHA incidents for lost work hours from an employee were events related to violence against a healthcare worker. It ranges from verbal abuse, physical aggression, to actual physical assault. These events are increasing the emotional and physical toll on our staff, and that is causing some to leave the healthcare profession altogether. We can't afford the loss of these skilled and compassionate caregivers if we want to continue to meet the healthcare needs of our community. Additionally, we also witness family violence at times. This may be between a patient and their family, where hospital staff and security are needed to respond to de-escalate the interaction to keep everyone safe. Or it could be one of our own very employees experiencing intimate partner violence while at work. These are very unsettling events. Violence against healthcare workers cannot be tolerated, and our staff should not have to accept this as part of the job. None of us signed up for this when we went into healthcare. Our employees need to feel safe in order to keep their focus on providing skilled and compassionate patient care. They should not only feel safe, but be safe when they come to work. We as a society must take comprehensive action. Bryan is doing their best by continuing to implement a multi-pronged approach to reduce these risks and prevent another tragedy like what happened in Tulsa earlier this week. And there is no one single initiative that's going to take these risks away, but we must collectively do all that we can to keep our healthcare workers safe. Continuing to create a zero tolerance environment for violence is essential. Holding individuals who commit violence against a healthcare worker accountable by filing assault charges and prosecuting to the full extent possible is important. What can the public and our patients or visitors personally do to help? Don't bring weapons of any kind into the hospital. Don't take out your frustrations or anger on the hospital staff who are trying their best to follow safety protocols and provide excellent care to your loved one. Accept and follow the restrictions and processes put into place for keeping everyone safe. If you are experiencing anxiety, depression, feelings of excessive anger, or thoughts of suicide, seek mental health services immediately. You can obtain those in your medical emergency rooms across the state. We must continue to collaborate and find solutions to stop violence in our hospitals and our communities. It's an essential thing for us to do. Thank you.
Thank you, Dr. Vale. Next, we'll hear from Alex Wilkerson, the Emergency Room Clinical Director for Great Plains Health and North Platte. Right ahead, Alex. Oh, I think you might be on mute as well.
Sorry, just went right in. Hello, thank you. I would just like to start off by thanking you for this opportunity to talk. And my experience comes from an inpatient unit in an ICU setting during the pandemic, and I transitioned into the ER setting about a year ago. And I will say this is all over. The violence that we're seeing, both physical and verbal violence, is in both settings, much so. Like you had stated, Jeremy, during and before, or during and after the pandemic, it just seems to have rose. And when I talk to the other staff and just myself and my experience, that is something that they've witnessed, and just their sensitivity, the patient sensitivity to everything that we do in the hospital. And really, we've just had to recognize that we feel like the community and patients and their families have lost control. When they come in, there's, they're fighting against the masking, they're fighting against, vaccinations, they're fighting against visitation rules and things that we've set in place for their safety, truly, but our community just doesn't see it that way sometimes. And so really just the day-to-day fighting those things with the families has been a struggle. And when I first moved into this role, one of the very hot topics was our security in our ER, and just trying to really mitigate the feeling of safety for our staff. Like Dr. Vale said, we do not want anyone else to leave due to this cause, but there is people who are feeling unsafe, and what we can do about that. At Great Plains Health, we have a lot of things that are put in place to help our staff feel safe. But we're meeting monthly, if not more often, to continue working on that. And especially with the recent situations we've had. We have versus tags at our hospital that every employee wears, and the tag has the ability, it has a button on it that you can push in any instance where you're feeling that you need more help. So a potentially dangerous situation, we call it a code gray button. So it works in our ER, our behavioral health unit, and then as well, we're going to push it out to our inpatient units soon. Out in our ER, we have high-grade bulletproof doors and windows for our lobby entrance. We have our security office and our registration staff so that they feel more safe in those situations. We have 24/7 security staff, 24/7 surveillance throughout the hospital. We have cameras that are motion activated, so we can catch these things. We recently in the ER had a patient get tased twice by law enforcement. A nurse was assaulted, and having that captured with video is a very important thing that we wouldn't have recognized we needed that until those instances happen. And when we're trying to do assault charges, those are really difficult, because if patients are under the influence or can be deemed in any sort of mental health manner, then those charges are harder. It's more of a gray area. It's harder to get those charges to go full. And so just those videos and that surveillance is super important. We do routine drills here with our community, with law enforcement, EMS. We do active shooter drills annually, and that we've found that is very helpful, making that real a live situation for the staff, and just making them think through that process of what we can do, what we can see, being aware of our surroundings, just more and more every day. Yeah, like Dr. Vale said, I just think we just really have to take a stand against this, and talking to the passion from the nursing staff is super important. When I was asked to speak here, I asked them all to give me their feedback and what they feel in it. It's scary. It's scary seeing these things happen in the media and in other places. So yes, we need to make a change.
Right. Thank you. Thanks for being here and for sharing that. Now we'll hear from Nicole Thorell, Chief Nursing Officer for Lexington Regional Health Center. Thanks for being here, Nicole.
Thanks, Jeremy. I just would like to start with violence against healthcare workers isn't an urban problem versus a rural problem. It is in every healthcare facility across the nation. With the increased stressors of the pandemic and the decreased availability of mental health service, we have seen an increase of aggressive behavior toward healthcare workers. Rather that be due to mental health crisis or an individual who is upset due to the regulations hospitals are having to enforce, such as masking, The daily incidences we are seeing are increasing. As healthcare workers, we understand that increased stressors that patients, family members, and visitors are experiencing. The frustrations are being directed at our employees on a daily basis. Anger and aggressive behavior appears to be at times the emotion that we are seeing first from patients, patients, visitors, and their family members. Due to these situations at LRAC, we have had to do additional ongoing training. It's not just the nurses that are experiencing this aggression from patients and visitors. It's not just the providers, it's the registration staff, it's the billing staff, it's the screeners at the front entrance. So we've really had to expand that training and do additional training into those positions that generally, such as de-escalation therapy, that was just generally for frontline staff, and then we've now had to expand that. We also now employ contract security to add an additional layer of protection and assistance for our staff. And we work very closely with our local law enforcement partners for their additional expertise. What we want people to know is that we're healthcare workers, as we always have been. Everybody generally goes into healthcare worker because we want to care for individuals. We want to make a difference. We are here to take care of you. We're here to assist you in finding the resources you need to help with your stressors, whether that be financial, medical. We are here for you. We are also required to follow federal regulations. And so implementing those and forcing people to follow those isn't always fun. But, you know, they're rules and regulations for a reason, and they're usually set for the safety of others. We understand that you're stressed and tired, and we want to be here to help. Instead of being angry about a bill or mad about having to wear a mask or taking out your stressors that really have nothing to do with us, we ask that you practice grace. Share with us your situation. Let us know what's causing you that stress, and allow us the ability to help you and take care of you as we have and always will. As both the other speakers said, this is something that has to change. We have to take a stance against it. Healthcare workers are leaving the field at astronomical rates, and healthcare is something that is always going to be needed. We want to take care of you as patients when you need us the most, and so we want that staff to be there. So we ask everybody's to come together and really work on this issue. Thank you.
Great, thank you. Thanks for that perspective from Lexington. Now we're going to be joined by Jeff Farmer, System Director of Public Safety for Methodist Health System in the Omaha area, and look forward to his comments. Jeff, go right ahead.
Okay. Thank you, Jeremy. First, I'd like to start out by saying that our thoughts and prayers are with the victims of not only Tulsa, but also Brooklyn, Uvalde, and all the other mass shootings that have happened across our nation. It is a traumatic event, no doubt, that causes stress in the lives of the people that it impacts. And even if it doesn't impact you directly, as you can see by this presentation here today, many people are impacted that were not even in the immediate area. So this really stretches among the gamut of those that work in healthcare. I'd just like to start out to say, first of all, I want to echo the comments of all the colleagues that are on this call today. Very important points that they raised and that they brought up. Here at the Methodist Health System, what we do to protect our staff and patients and visitors as well is we've conducted a comprehensive risk assessment across our health system related specifically to workplace violence. From there, we take that information, put into an executive summary, and send it to our executive leadership. This is important because we get the buy-in from our senior leaderships. They understand what's going on, and they know better how to support the overall mission to keep people safe. It's really all about creating a culture of safety. All right, and then it's also about empowering employees to be able to take action, right? From a security standpoint, what I like to try to do is just have my officers just be another tool in the tool belts of our clinical staff and other employees as well when it comes to dealing with these incidences. So we're a resource. One of the things that we focused on is the policies, procedures, processes, support mechanisms that we have, internal resources of support, whether they be our behavioral health response team, our crisis intervention teams, our security teams that respond, other internal resources, such as our chaplain services, external resources, such as the employee assistance program. Whatever we can do, let staff know that they have these resources available. The other thing is just the other education, right? Knowing what's available to them. Immediate supervisor, you have a security officer to respond to help. I think that once staff know that they have that support and the resources that are available to them, it helps them better to respond to these events. Additionally, what I like to add is that we do our sanctioned program within our health system is nonviolent crisis intervention taught by or sanctioned by the Crisis Prevention Institute. That is our mainstay of providing that formal education and training to our staff. And it's all centered around teaching staff how to de-escalate and respond to behaviors that may present to them and what the appropriate staff response is. We feel that with that also empowers them. If they can de-escalate a situation, there's less likelihood of a violent event will occur. Again, like many of my colleagues have said, we've seen violence come in from all ways, be it regular verbal, physical. We've seen it coming from patients, family members. I will tell you that 95% of the assaults that occur within our health system are patient on staff member, on employee. And so we take a comprehensive approach in that method to make sure that we keep our folks safe.
Thank you, Jeff. Thanks to all of our presenters. Just a reminder from the media, if you have questions, please go ahead and put those in the chat box and we'll go through those. As Dr. Vale mentioned, certainly we want to protect our healthcare workers and address violence in the workplace. We're at a staffing crisis still post-COVID in our hospitals, and we know that this is a major driver for a lot of people to leave the profession. So it's just going to make the situation worse. It becomes a little bit of a downward spiral. As we lose staff, as people have to wait longer for services, the frustrations build, and it really becomes a challenging situation to climb out of. So it's one of our pieces as we talk about how are we going to strengthen and grow and rebuild our healthcare workforce. Addressing this has to be one of the main pillars in that. The other piece that I would just add, and just echoing some of the comments, is we see violence throughout our community. Obviously, as we mentioned, 5 times more likely in the healthcare setting than in other workplaces. But just want to encourage Nebraskans to do their best to show the compassion that our families and that our neighbors need when they're going through challenging times. Reach out, find ways to embrace and engage with those individuals who are struggling, and whether that's in a hospital setting or at home. That's the fastest way, maybe not the easiest, but certainly the fastest way to address violence that we're seeing throughout our communities and throughout our country. All right, with that, I'll start with questions. Again, feel free to put those in the chat box. First question: are there additional steps any of you are taking given the unfortunate events in Tulsa? Has that forced any actions in the last few days?
I'll take that one. Basically, it's increasing staff awareness, right? We have policies and procedures and protocols in place, and events like these generally put people in a heightened sense of sensitivity to what's going on. And so this is an opportune time to revisit those policies, to revisit those plans, to revisit those procedures. Again, it's all about empowering our staff to know what actions or what appropriate steps that they could take in the event that something occurs. The other thing is that from my standpoint, our security directors, we provide in-service training, just-in-time training. So any of our leaders, department leaders, unit leaders can call one of the directors, we will go in, we will provide that in-service training, whether it be a lunch and learned or something to that nature, to make sure that they have the education that they need. So we're really available to provide resources to assist, okay, to go over some of these training points, to reiterate some of the policies, again, to let them know what resources are available to them. Just like all the other health systems and other hospitals around, we do experience high turnover. And so there's a need for that constant refresher training and the need for the availability.
Thank you. Thanks. Next question is, we have a reporter wondering if anyone can quantify how much worse violence in the hospital has been pre-COVID versus during COVID. Any thoughts on that, Nicole?
Sure. I definitely think we've always seen a fair amount of violence towards healthcare workers. In our own facility, I feel like the aggressive behavior, the angriness has definitely increased since the start of the pandemic. Patients are experiencing frustrations on a different level, whether that be financial, not having the ability to come into the hospital to see their family members, and they're worried about how sick they are and if they're going to see them. And so I think we're seeing a lot of that aggressive, angry behavior due to some of the changes that we've had to put into place for patient safety. I think there's just a lot of stressors with the pandemic that people aren't able to deal with. And so their frustrations are coming out towards the healthcare workers. So we are seeing a much more high incidence with aggressive behavior towards our registration staff, our schedulers, our billers, our payment office, outside of just the emergency department and the places that we generally saw it before. And so I think that's where we've had to really step up and increase our awareness and our training and provide them with the resources and let them know the resources that are there. And just, really reaching out and working with our patients in our community on resources for when you are having an issue, whether that be financial, whether that be mental health, and providing that additional layer of education.
Bryan, I would say I can't quantify it, but I would say it's significantly worse. And I believe in the past, much of the anger we would see on the clinical units, now people walk through the front door and they're angry. We've actually had our volunteers at the front desk physically assaulted when trying to encourage individuals to put on a proper mask, or when we were limiting visitation, really strong reactions to those kinds of things. So it is significantly worse. And even with the pandemic numbers, the COVID positive numbers being decreased, I have not seen a corresponding reduction in the anger and the hostility that we've seen in the hospital.
Next question is related to the staff tied to hospital violence, and how serious are the issues of staff leaving because of trends of violence, and is this causing staff shortage, or could it in the future? Alex, would you like to take that one?
Yeah, I would. I don't have numbers by any means, but I can definitely speak to how you said, Dr. Vale, how people are now coming in angry. I think we need to remember that we're all humans, and healthcare workers are dealing with a lot of the same stressors that the community is, and that when we come into work, we're carrying those stressors as well. So then when we are treated with anger and disrespect, and I feel, I had a staff member mention that they feel like, just not related to COVID, but just any other diagnosis, that the need for the right now treatment is, and then with no grace, has gotten higher. And so I do think that we're going to see a lot of staff members leave, especially our emergency department area. I've had, when you have nurses who've worked down there for quite a while, this just kind of puts the, kind of knocks it off. They say, well, I've done this for a long time and I just want to get out of here if I have to put up with this. So I do foresee this happening more if we cannot get a hold of it. So.
I would say that Staff that experience this can develop post-traumatic stress, and it can cause long-term negative results that drives them out of the workforce. One of the other things that we've seen, and it's not been a really large number that I'm aware of, but it's the nurse's significant other who is fearful for their loved one's safety when they're working, and is using influence to say, I don't want you to be there anymore. I'm concerned about your safety, and you need to find another job or another place to work. And so and with nurses being predominantly female, that can impact a marriage and can impact, all of those other things outside of the hospital. So we see that as well.
Thank you. Thank you. Any final questions? Wait just a second here. Don't see any popping up. Well, just wanted to say thank you to all of our panelists for being here and sharing the stories from your facilities, and then wanted to thank our media partners on the phone for helping joining us today, and for helping us get this message out. We did have one more question pop up, but it's obviously an important message to get out. Okay, we'll do one more here from Andrew. What's to blame for the increase in hostilities? I know some of you have talked a little bit about during COVID. Any thoughts on that?
I think you stated it best, Jeremy, when you said to practice compassion. I think with the pandemic, everybody had increased stressors. You had increased things to worry about. And I think our ability to practice grace and not to just get angry has really decreased. And so I think the quickest way, as you said, is to practice compassion. Understand that that person may be having a hard time right now, and to sit and listen, ask them, what's frustrating you? What are you upset about? How can I help? And that's not when they get to the hospital and they're angry at the healthcare worker. That's at home, that's at the gas station, that's at the grocery store. It's remembering that these are our friends and the neighbors and our community members, and we really need to take care of each other and help each other to really resolve whatever it may be that's causing our increased hostilities.
Great. All right, great. Thanks, everyone. Appreciate everyone's time. And for the media, if you have any follow-up or questions for the Hospital Association, always feel free to reach out to us. Thanks. Have a great day.